Thank you for joining us today. Prescriptive Health Solutions is proud to present Own Your Health, becoming a wiser consumer of healthcare and wellness resources during challenging times. Today's consumers are informed healthcare consumers. Healthcare information came around during the 90s, evolving websites like WebMD and Google, bringing complex medical information into homes and to patients who were hungry for more information. Everyone with access to a computer can now read everything about medicine. As healthcare continues to evolve, especially during these challenging times, patient expectations will continue to be shaped by their experiences, not only in healthcare and online, but from other industries such as retail, technology, and other consumer-oriented industries. Let's stop a moment and consider. A lot has changed over the past 4 to 5 months. What was normal and routine then is vastly different now. It is normal to feel confused, anxious, frustrated, depressed about life and the things you don't have any control over. The COVID pandemic can feel overwhelming due to new information, longer working hours, and caring for family as well as yourself. It's important to pause for a moment and collect your thoughts, as this pandemic can be taxing. Remaining calm can help. Taking care of yourself is important, so you are equipped to help you and your family through this challenging time. As you become a wiser consumer of healthcare, it's important that you access the resources that are available to you. According to the U.S. Department of Labor, women make 80% of healthcare decisions in the United States. And because women are the main medical decision makers, primary care teams know conversations with women can have a significant impact on the health of their entire family. Women are often interested in discussing preventative health topics such as nutrition, smoking cessation, and vaccines, and then use this information to help improve their family's health. But the most important supporting factor for women to make good healthcare decisions is to have a strong relationship with a provider that they trust. Women are often considered the chief medical officers of their home. However, this too can add stress to women and mothers who take responsibility for their family and loved ones. Self-care is more than one-off practice, and during the coronavirus pandemic, it is vital to practice it more than you typically would. Make sure you are giving adequate attention to your physical and psychological wellness during this time. Deloitte conducted a survey of U.S. healthcare consumers and found that people fall into 6 distinct consumer segments that navigate the healthcare systems in very different ways. Of the 6 represented, the top 3 make up 73% of the population. The top one being casual and cautious, the second highest content and compliant, and the third highest online and on board. Of the casual and cautious, this group is not engaged and has no current needs and tends to be cost conscientious. The second group, content and compliant, tend to be happy with their physician, their hospital and health plan. They trust and follow their health plan. The online and on board tend to focus on online learning and are happy with care, but interested in alternatives as well as technologies. Which one best represents you? COVID-19 has changed the way in which we might be consumers of healthcare now and into the future. The spread of the coronavirus is changing the landscape of healthcare consumerism, with patients already beginning to engage with the medical industry in unprecedented ways. According to a recent report from PricewaterhouseCoopers Health Research Insights, this report compared over 2,500 survey responses from early April to consumer sentiment before the outbreak, revealing that healthcare consumers are more interested in engaging with the medical industry by telehealth and also by sharing their data for research. However, on the flip side, they're also concerned about their own expenses, causing many to engage less with chronic care management guidelines and medication adherence. We need to be careful here. These trends are concerning considering the role medication adherence plays in chronic disease management. Patients who do not take their medications as prescribed run the risk of developing an acute health need that could land them in the emergency room, which is both high cost and a breeding ground for COVID-19 germs. Many pharmaceutical companies are offering discounts or access to free medication for those in need. It's important you talk with your pharmacy benefit plan administrator about this information. Also, many healthcare plans are extending free access to COVID lab testing or increasing access to resources at a reduced cost or coverage under your plan design. Be informed. It helps to know what you have access to. While COVID-19 has changed the way in which we might be consumers of healthcare now and into the future, you must stay the course. Refer to your health benefits and plan details. Know what to use and how to use it. Don't be afraid to ask for help. Access your physician or healthcare provider online or by phone. Use the resources of your pharmacy. Talk to a pharmacist. Talk to someone about your stress. Leverage your employee assistance program. Be well. Choose a healthy lifestyle. As we deal with the uncertainty of the world around us, as well as the pandemic situation, it is easy to become anxious. Recognize what you can control and let go of the things that you cannot control. Focus in on some of these 4 key areas. Number 1, hand washing. Secondly, staying at home. Third, limiting unnecessary travel and contact with others. And 4, simply being aware of those who may be at risk, such as the elderly, and choose behaviors that lessen their risk. The more that you can focus on these key areas, the more it helps ground you and gives you some guardrails and focus. Your personal choice and behavior and how you react to the world around you influences your words, your thoughts, actions, and behaviors. You might find that your daily routine is affected by this coronavirus outbreak in different ways. So as you own your health, consider sticking to a daily routine. Have regular times for getting up and going to bed, as well as meal times. For those that are working from home, maintaining a routine can be challenging. The temptation to sit in pajamas all day is very real. Try to stick to a working routine as much as possible, including structuring your day with regular breaks. Minimize your distractions. Stop for lunch. Get some fresh air. Avoid staying in the same position for prolonged periods of time, and stay hydrated. We live in a world of a 24-hour news cycle, and the information is constantly changing. News and social media can affect our emotions in ways that cause anxiety, sadness, panic, anger, frustration, and even outrage. This can affect our mental well-being. Be aware of your emotions. In times of uncertainty, our emotions are on high alert. Pause and think before you react to what you read or hear. Focus on the facts. Recognize the emotions that you are feeling. Consider stepping back and re-examining the need to respond or even consume this information if it makes you anxious. Protect your mental health and well-being. Choose better physical health. Exercise every day. Take deep breaths and stretch often. Spend time outside, such as going for a walk in the park, but follow social distancing guidelines. Fuel your body by eating a healthy, well-balanced diet and drink plenty of water. Try to get 7 to 8 hours of sleep each night. Avoid risky or destructive behaviors such as drinking alcohol or abusing drugs, excessive gambling, or ignoring public health recommendations. Choose to have a healthier life. Be aware of your mental health. Forbes recently posted an article that addressed the pandemic situation, quoting that 80% of the US population is affected in some way, experiencing stress or anxiety as a result of the healthcare crisis. The effects of the pandemic are far-reaching and affecting our mental health, especially for those who are in some form of forced isolation, such as the elderly. Their access to people and humans are very disrupted. Some things that you can do to help improve your mental health is set and maintain a routine at home. Focus your thoughts on the present things and things to be grateful. Listen to music or read books. Lean on your personal beliefs and faith for support. Acknowledge and appreciate what others are doing to help you and your community. Stay connected. Use technology to maintain social connections with your loved ones. And if you're able to, consider regular check-ins to give you something to look forward to. You can also look for ways to help your community, such as blood donations, checking in on older people in your neighborhood, or donating supplies or money to local organizations. However, also be aware that if things become persistent or interfere with daily functioning and are outside the norm for this pandemic, contact your provider for help and guidance. Some of those things might be trouble focusing on daily activities, anxiety that turns into feelings of being out of control, or strong feelings that interfere with daily activities, or possibly having emotions that become difficult to manage, or feeling hopeless or helpless. If you are at that point, please call on your healthcare professional for assistance or your EAP services. It is so important to make sure you take care of your body, your mind, and your soul every day, not just when you get sick. Learning how to eat right, reduce stress, exercise regularly, and take a time out when you need it are touchstones of self-care and can help you de-stress, stay healthy, and be resilient during these challenging times. The following links take you to resources that can help empower you and take your health into your own hands towards a healthier lifestyle. These will help enhance and build upon the health and wellness resources that are already provided to you by your health and wellness benefits team. Links to these sites provide access to coaches as well as top fitness apps for things that you can do and initiate on your own. And as we leave you with a parting thought, grateful living helps us to unleash our most generous selves as we practice taking nothing and no one for granted. Thank you for joining us today. Be well.